It's my great privilege to welcome you to this most special occasion. Today we honour the memory of a great Irish man, a chemist and public health champion, Sir Charles A. Cameron. And we celebrate the leadership of another Irishman, Dr. Mike Ryan, who's been at the forefront of the global response to COVID-19. Through the inaugural Sir Charles A. Cameron Award for Population Health, which we present today to Dr. Mike Ryan, we draw a storied line from Sir Charles Cameron's relentless drive to improve the lives and health of the citizens of Victorian Dublin and the role of population health in the pandemic we are living through today. Born in Dublin in 1830, Cameron embarked on his extraordinary career in 1846 when at the age of 16 he began an apprenticeship in the laboratory of Bewley and Evans. Within a year, he was reading books on chemistry, physics, geology and medicine, and attending lectures at the Royal Dublin Society. By 1852, he had become Professor of Chemistry at the Dublin Chemical Society. Cameron embodied both the theory and practice of public health medicine. Appointed Public Analyst by the Corporation of Dublin in 1862 and Medical Superintendent Officer of Health in 1879, he faced frequent outbreaks of infectious diseases like scarlet fever, dysentery, smallpox and typhoid. During these years and throughout his career, he created opportunities to influence at the highest level on behalf of those with the least means across society. In 1879, he personally inspected every tenement house in the city, an experience which led him to form the opinion that the wages of unskilled labourers were inadequate, and that the difference between those and the wages of more skilled workers were too great. He believed that greed resulted in people living in grim, filthy slums where infectious diseases were rife, that sparse work meant hardly enough money for food, and that a lack of sanitary provisions, clean water and effective sewerage stole people's health. When strong evidence emerged internationally that the water people used was the source of various infectious diseases such as cholera and typhoid fever, Cameron examined and reported on water samples taken from wells, pumps and rivers from all over Ireland. He became a leading voice on the Dublin City Corporation Committee, tasked with demolishing slums, building houses and constructing sanitation and water supply systems where the issues were most acute. He was relentless in his pursuit of suppliers of adulterated food and contaminated milk. This campaigning work was honoured when he received a knighthood in May 1885 in recognition of his efforts to improve housing for the poor of Dublin. Charles Cameron had a deep connection with this institution, the Royal College of Surgeons in Ireland. In 1868, he was appointed Professor of Hygiene at the college, a role focusing on the science of the physical condition of humankind and the means by which good health may be sustained. In the summer of that year, he delivered a course of 12 lectures on public health, attracting large crowds and considerable attention in the press. In 1875, he was elected Professor of Chemistry and Physics at RCSI, a role in which he delivered 60 lectures annually. He was steadfast in his connection with RCSI, and in 1884 he was elected Vice President of the college, and in 1885 he became President. Indeed, it was during his tenure as President that women were first admitted to RCSI when Agnes Shannon enrolled in chemistry in 1885. Founded as the national training body for surgery in Ireland, RCSI has been at the forefront of healthcare education and research since 1784. Today, we are an innovative, world-leading international health sciences university. As a university solely focused on human health, we have a deep professional responsibility to enhance human health, and our mission is to educate, nurture, and discover for the benefit of human health. This commitment to human health is reflected in our position as number one in the world for good health and well-being in the Times Higher Education University Impact Rankings for 2020. The importance of population health, so obvious in the impact of Charles Cameron's work, has never been as relevant to our lives as it is today. Through the work of Dr. Mike Ryan and his colleagues across the world, we see clearly the role of public health and epidemiology in saving lives. Our academics and researchers in population health are working to build global understanding of health, diseases and their determinants, honouring the legacy of Charles Cameron. I'm delighted that we're joined today by three of Sir Charles Cameron's descendants, Miss Liz Stanley, Miss Kate Richardson, and Mr. Philip Marchant. I hope that our commemoration of the centenary of Sir Charles Cameron's death demonstrates to you the regard this university has for him and his legacy. Thank you again for joining us today. I now hand over to Professor Kieran O'Boyle, who will chair today's panel discussion.
Many thanks, Cathal. It's an honour to be here today to be part of the inaugural Cameron Award for Population Health. We are joined today by Dr. Ida Milne, epidemic disease historian at Carlow College and visiting research fellow at the Department of History in Trinity College in Dublin, Professor Donal O'Shea, who's professor and head of the chemistry department here at the RCSI, Dr. Mike Ryan, Executive Director of the WHO Health Emergencies Programme, Professor Emer Shelley, who's the Dean of the Faculty of Public Health Medicine at the RCPI and Honorary Associate Professor of Epidemiology here at RCSI, and Dr. Kieran Wallace, historian and Deputy Director of Beyond 2022, Ireland's virtual record treasury at Trinity College, Dublin. Kieran, could I start with you, please? Your expertise lies in understanding Dublin's social and political history. Could you open for us by setting the scene in terms of the Dublin of Sir Charles Cameron's day, especially as that related to public health?
Sure, yes, it was really quite a tragic city. The key words to think of, I think, are dilapidation, overcrowding and poverty. This is largely because the city was trapped within the Royal and Grand Canals. It couldn't expand into the suburbs and became increasingly overcrowded. To give an example of how bad the situation was, in 1900, there was an inquiry into the terrible living conditions in Dublin and the public health situation in Dublin. And it was found that over 60% of Dublin families were actually living in third or fourth class accommodation. Now that's accommodation we wouldn't even consider as habitable today. So well over half the population, well over half the families in the city were living in these multi-occupancy dwellings and on occasion even multi-occupancy rooms. There were instances of 4 families sharing a room divided by blankets and the landlady living in the centre. Very poor access to pumped water, a pump in the backyard of the tenement buildings, the privies shared by the entire household, so women tended not to use the toilets, they would use chamber pots in their room. The toilets were completely unsanitary, and the idea of trying to reform this was something that Sir Charles Cameron worked on quite a bit, trying to reform housing. But the city he was facing, the challenge he was facing was really quite remarkable. The death rate in Dublin exceeded the death rate in London or 35 other UK cities at the time. So it was seen as a real problem city.
That's extraordinary. That was the perfect melting pot for infectious diseases and for transmission of infectious diseases. Kieran, I know you know a lot about the smallpox epidemic, the 1902-03 epidemic. Could you say something about that and Cameron's involvement in that?
The smallpox epidemic was something that they had dreaded. It was a much feared disease because of its transmissibility. And it arrived in with, it was smallpox in Glasgow and in Liverpool, 2 big trading partners of Dublin. And a single case of a sailor staying in a very crowded tenement area in the North Docks was identified, and he was brought into a hospital, identified as having smallpox. And then quite rapidly, the city's sort of machinery kicked into gear. It wasn't a very efficient city at the time. Dublin had terrible trouble organising itself, but with Charles Cameron behind it and with the new powers that the city had recently got as a public health authority, he sort of pulled all the right levers at the right time. You can sense the horror in Cameron's reporting of the time when a case broke out, an apparently unrelated case broke out in number 56 Church Street, where 11 families shared one 3-storey house, the epicenter of sort of overcrowding. He managed to, by activating, he built a temporary hospital, a prefab hospital in 21 days. He pulled together late night vaccination centres and set up a city refuge where he had, I think, about 1,400 people who were close contacts were sort of put into the refuge while their ill family members were then treated in this purpose-built emergency fever hospital down on Pigeon House Road. And by doing that, Dublin was spared a much worse fate that was suffered by Glasgow and Liverpool. I think there were about 33 deaths out of 233 cases in Dublin. And Cameron was quite rightly quite a self-congratulatory piece he wrote a year later, but I think he deserves the congratulations.
Extraordinary. Thank you very much for that, Ciara. How relevant that is for us today. Ida, can I turn to you, please? You're a specialist on the history of infectious diseases, and especially the flu pandemic that hit Ireland in 1918 to 1919. You cover that in your book, Stacking the Coffins. Cameron was very involved, of course, as we've heard, in the management of infectious diseases. Could you paint for us a picture of that time and the parallels that you see between the flu pandemic and the current situation that we find ourselves in?
In many ways, the parallels are very strong, because there were 3 waves of that flu pandemic with much the same timings. It's quite incredible, really. It's an early summer epidemic in 1918, then an autumn wave, and then the 3rd wave in the spring of 1919. And Cameron, really, his opinion was constantly sought out by the newspapers, by the journalists, because he gave really good, strong, clear, simple, easy to use advice. And it's something that I think it's a very important thing for us to recognize now. And I think we have recognized, is that messaging is really important in times of crisis, that you have to keep the messaging simple, because people in a panic don't take messages in very easily. So he gave, his advice was very much, Cameron was a man who communicated about public health and went to conferences in Europe and engaged with public health specialists all over the world. And he was really on top of his game at that stage. He was 88, and he'd been working to improve the health of Dubliners for 50 years. And bad and all, as Kieran was saying, the conditions were, in the 20th century. In the 1870s, I think in one of his last annual reports, he mentions that in the 1870s, there were 9 deaths from infectious disease per 1,000 each year, whereas by the 1910s there was just over 1 death from infectious disease per 1,000. So it was a huge improvement, even though there was still a lot more to do. But again, in the 1918 flu, he was very much the person who was sought out and gave really strong, simple advice. Stay away from crowds, much like the advice we get today. Focus on hand washing, and if you go to bed, if you catch flu, go to bed and stay there until you're well better. And the reason for this was that many people recovered from the flu and then died from a subsequent pneumonia. And he was very keen on that. And he also was all the time going around monitoring things like the cinema houses, the different public buildings, and telling people, what they ought to do, the actions they might take. He was very sympathetic to businesses, actually, and tried to keep them open as far as possible at the time, but insisted that they would disinfect between showings, for example, in the cinemas, or daily otherwise.
It's fascinating to see the parallels there. And I know, Ada, for you as a historian, it's very important to have these the sort of oral histories of people like Sir Charles Cameron. I think you're involved in that currently as well. How important is that? Because you wouldn't have had a lot of documentary evidence for his putting together, your report on that time.
Yes, well, Cameron did write a memoir. He wrote it in 1913. So I have no memoir from 1918-19, which I'd love to have. And indeed, we've only one really good account from a Dr. D.W. McNamara, who worked in the matter at that stage, and he wrote his memoir of it in the 1950s. So the Royal College of Physicians, Harriet Wheelock is collecting, and I think it's really important that medical people of all sorts who are involved in the pandemic should donate their oral history or some form of memories of what they're going through at this time, so that future me's can work on them.
That's quite a lesson for us for today, Ada. Thank you very much. Emer, you're Dean of the Faculty of Public Health Medicine. Could you say something about what you see as the lessons for us today, particularly in COVID times, of what we know about Sir Charles Cameron and his time in Dublin?
Lydia Carroll's book, In the Favoured King's Preserves, to be really inspirational. His concern for the poor was so obvious throughout his career, but Cameron's concern wasn't just theoretical. He went out there, he visited the tenements, he met people in their rooms, He listened to them, he visited the abattoirs, and he did really what we would call qualitative research today. And he used all of that to get creative solutions to the problems. So when he was getting rooms fumigated, for example, people had to stay out in the street. And he designed and had made up a mobile hut that they could stay in. But they didn't like that, because that meant that everybody in the neighborhood knew, oh, their house is getting fumigated. So he accessed rooms that they could go to in a public building where they would be dry and warm, but the neighborhood wouldn't know about it. But he was also very careful to count everything. So he counted the rooms, the houses, the tenements, the people, and he reported on all of that. And he reported on the work of his inspectors. So he had reports to the corporation every couple of months, and an annual report. And of course, that tracked his work. So when people challenged him, he had all of the evidence there. He had the context of the connection to the corporation, but there were vested interests on that corporation. Nevertheless, he did get support from them, and they gave him resources, and that was why he was successful. There were, of course, many other vested interests, and there were legal constraints. But his overriding characteristic probably was sustained and persistent advocacy and the methods that he used. So he actually printed a pamphlet at his own expense. He called a meeting of what we might call middle-class people to explain to them how really poor people lived, how low their income was. They were living on water and tea, and bread and so on. He had a public health conference and smartly invited Lady Aberdeen to it. So he crossed the political divide as well as the social class divide. And that political context was important in the later part of his career, in particular, at two ends of it, if you like, where the housing inquiry in 1913 was deemed to be quite orientated from the Republican perspective, and really didn't give him the due credit for all of the work and achievements in public health. But nevertheless, he was the person who was asked to go to Frongog, where the Republican prisoners were being held, and his report was important. He listened to them, and they were subsequently released. He had that important international context too, where he learned from people, but also was a leader. So at the Vienna conference of the Hygiene and Demographic Society, he was the person who chaired the medical officers of health meeting within that. So he was an amazing person. He had an extraordinary work ethic, but somehow he managed what we would call work-life balance. So he'd have a party for 100 or 200 people in his house until the early hours of the morning, and yet he'd be back in his laboratory first thing the next morning. So he had an extraordinary energy and a really positive outlook. So great lessons for public health today.
That's wonderful. Thank you very much for that, Emer. Wouldn't it have been great to have been able to meet him, particularly at one of the dinners? I'm going to go to you next, Mike, if I may, please. And firstly, congratulations on being the first recipient of the Cameron Award. Hard to think of anybody more deserving. So, Mike, you've spoken in the past about the need to counter misinformation with scientific evidence, especially in dealing with these kinds of pandemics. Could you elaborate on that for us, please?
Thanks for your kind words. I can certainly think of a few who might be more deserving of this award, but I'm very honoured to receive it. The picture you paint of Cameron is just so relevant to today. It's so entirely relevant to what we're facing today. Everything from getting your act together from a governmental point of view through to the temporary hospital, the late night vaccination centres, the giving refuge to family members, having a non-stigma based approach to giving interventions at community level, standing up as an advocate for the underpinning determinants of health. He's quite the modern person. Maybe those of us who are so specialised look back with great fondness at when one could be a polymath, one could be a master, a jack of all trades and potentially a master of none. But he seems to have been a master of many of these cross-sectoral trades. And in that, just reflecting on the infodemic or the information management, and I think Cameron espoused that, there is no control of epidemics without the community. The community are not the beneficiaries of our knowledge. They are partners and the first line of defense. And if that community don't have the right information, in fact, if they have a menu of disinformation and misinformation, there's no amount of science can push a community towards taking the necessary actions. But Cameron also knew you can't just point your finger and ask communities to do things. You have to empower them to get those things done. You have to provide the services and the support so communities can actually participate. So never, I mean, it was a case then, we didn't have the internet, we didn't have anything else. I've seen the same in the most rural parts of Africa. Information and disinformation did not start when we got social media. It's been an essential part of this. We saw TB in the 50s in Ireland, we saw HIV, how stigma, misinformation, and misunderstanding drove negative behaviors both within and outside the medical profession, at society level and other places. So managing that now is even more of a challenge. But I don't think we should be looking to go after the messengers. We just need to be better at translating science into the knowledge that people need. We need to get better at doing that. That is becoming an ever more important piece of the population health agenda. And, you know, I really like the way the Royal College have focused on the idea of population health. It's about, and I think in 1864, one of the first public health publications by Cameron was on, I think in 1864, on, I think it was called On the Preservation of Health, not on the restoring of health, but on the preservation of health. And in that regard, preserving health requires that people have the right information. And we are now facing a major dual challenge. We have an epidemic and we have an infodemic. And we as public health servants, we as population health practitioners need to be very, very careful to develop and learn the skills of how to engage in this very complex and dynamic area.
Thanks for that, Mike. And we certainly here at RCSI have ramped up our engagement with the public and see public health education as a key part of our duties or responsibilities. Could I ask you, Mike, Cameron was a great advocate for the poor, and he understood the relationship between poverty and inequality and health. And you've spoken very movingly in the past about the extent to which the current epidemic reveals health inequality, and you've talked about the need for health security that's revealed here by the COVID pandemic. Could you say a little bit more about that, please, Mike?
Yeah, I think those great health movements of the latter part of the 19th century, you know, really moved health forward in terms of identifying the driving or the underpinning conditions, the underpinning drivers of ill health, from poverty to overcrowding, so many other things. But I think, in a sense, that association has waned in people's minds as we've developed secondary and tertiary health systems. We can cure everything. We have a cure-all approach. It's finding the cure to everything. It's not necessarily about preserving that health that we're innately born with. And I think Cameron understood that at a fundamental level. Why repair something that we're allowing to be broken by the way in which people have to live? You know, that's just doesn't make any sense. Economically, it doesn't make any sense. Socially or ethically or morally. And we see that continued and played out again and again and again and again right around the world. And in that sense, that link is there. And in some senses, I've likened this before, that we bandaged up those wounds in the late 19th century and maybe in other places over the last century. But what COVID has done is ripped away the bandages from that very old wound in our society. And it has just, to an extent, exposed what was already there. It in itself, it has driven much. I mean, clearly, COVID is killing people. But what it has uncovered is something that is much more fundamentally disturbing about how far we have really got in preserving population health and ensuring a healthy planet, ensuring a healthy population.
That's really interesting, and hopefully one of the things that will come through from this is a greater understanding of climate change and the impact of that, and the fact bad things can happen very quickly on a very large scale. Charles Cameron's life, his own life, was marred by sorrow and by grief. He lost 5 of his children, and his wife predeceased him. In fact, he lost 3 of his children to infectious diseases. You've spoken in the past, Mike, about the mental health impact of this pandemic. Many people, as we know, have sadly lost loved ones. There's a great deal of grief out there. There's a huge challenge to the mental health of our populations. How do you see that, the impact of that playing out in the next number of years?
I think it's a great unknown, but serious to say, the impact is there, and it will continue, and it will resonate through the decades. I think first and foremost, I think families who've lost loved ones, ask themselves the question, why have we come to this? We expect the system to be able to preserve and protect health, and here we are losing people to a novel infectious disease. Frontline health workers have really suffered a major toll, and not just those working in the absolute front lines, but those who've had to preserve other services, people working in the front line in nursing homes and in care facilities. It's been terribly impactful on them. Many of them have really feared taking the disease home to their families, and have lived in terror at that prospect. And I've seen people die, and I think one thing we've all know as practitioners is that last moments of life, however tragic, can be made in some way special by the presence of family members. And the fact that so many people have died alone, with the last face they've seen as someone in goggles and a face mask and a UVEX suit. I've seen that in Ebola over the last 25 years. I've seen the impact that has at community level. So there are terrible, horrific impacts there. But beyond that, our young people have lost huge amounts of time in their growing up part. Our social lives have been interrupted, our economic lives. Everyone has somewhat recovered from the 2008 crash, and now all those financial worries are back again. It's almost PTSD time, I think, for many people economically. So there's a lot of impacts. And I think we are going to, in our recovery plans, really have to take mental health as a major pillar of recovery, not just rebuilding our ITUs or restocking our stockpiles and doing all the other things we will do. I think we really have to look very carefully at how we recover mentally, socially, economically, culturally from this event, so that we are resilient enough to face whatever comes in the future. The toll has not been counted yet, and it will continue, I think, for years to come.
Thanks very much for that. And I think that's one of the things we're concerned with here in the RCSI. We're very influenced by the original WHO definition of health as physical, mental and social well-being. Thanks very much for that, Mike. Donal, you're the successor here in RCSI to Sir Charles Cameron as Professor of Chemistry here, and you also run the Cameron Laboratory for Chemical Biology. Could I ask you a similar question that I asked Mike there? How important is it that we have scientific evidence and we have this alignment between scientific research and clinical practice?
It's actually essential, and I think that's what Cameron established right from the beginning. He put all his efforts into building the infrastructure to do the analytical work that would prove the tests, that he could convince not just the public, but the political powers, the legal system, and the people who had a lot of influence in the city at the time, that would be the traders and merchants, because his findings were often going against these people, because he would point out that their products were inferior, they were contaminated, and he managed to establish the link that showed that that was causing disease within the city. So there are many examples that have been reported where he would have shown contaminations, for example, of milk products, were leading to outbreaks of typhoid fever, and he would trace that back to individual dairies, where then they would be fined and potentially threatened with closure. But being able to do that for the first time in a city that was really reeling at the time was an enormous achievement. but starting from building with the scientific knowledge of his analytical chemistry, because that's where his initial training was in. But then he would have to bring that into the medical arena, then into the political arena to get support for his laboratories, to get support for his tests, and ultimately into the legal system, where he influenced the change of the legal system so that it could be enforced to have change occur throughout the city. So he was really quite remarkable, starting from science and building the knowledge outwards.
And has that legacy continued on through your department? Are you aware of that legacy in terms of how you communicate research in your own practice, in your own research lab?
It's very much that's one of the most essential components of it, is how you communicate what the work is being done in your laboratory, and how to do that in a fashion that people can understand it and have meaningful impact. That is essential to the research. It can't remain behind the closed doors of the laboratory. It has to have impact out into society, and you have to be able to explain it to society in the terms that make sense to them. And that is very much a driving part of our department, still within RCSI, from the very foundation of the department back in the 1800s.
It's quite amazing. We had a chemist, it's very interesting, we had a chemist who was president of the RCSI at that time in Cameron. What are the main areas of research that are underway in the department currently, Donald?
Probably one of the more relevant ones currently is research from the Cameron Laboratory recently was establishing a cause and effect link for the vaping-induced lung injury outbreak that occurred in the United States last year. And we were able to identify by doing specific chemical analysis, that one component that was being illegally added to specific vape mixtures was causing these lung injuries by producing a toxic gas. So still, the research is very much in the framework of public health coming from the department. And that's just one recent example from work from his laboratory.
That's really interesting. Thank you very much for that, Donald. So that brings us to the end of our brief discussion on Sir Charles Cameron. I want to thank sincerely our panel, Dr. Ida Milne, Professor Donald O'Shea, Dr. Mike Ryan, Professor Emer Shelley, and Dr. Kieran Wallace. And at this point, I'd like to say a particular word of thanks to Mary O'Doherty, RCSI Assistant Librarian, whose interest and acumen has been a major driver for this initiative. I'm going to finish with a quote from Sir Charles Cameron, which is, I think, as relevant today as it was in Victorian times. He said this: "The days of health outnumber the hours of sickness. We rejoice infinitely more than we mourn. Love predominates over hate. There is more happiness than misery, and even pain has its uses as a preserver of life and as an incentive to pity." I'm now delighted to welcome Professor Hannah McGee, Dean of the Faculty of Medicine and Health Sciences here at the RCSI, to deliver the citation for the inaugural Sir Charles Alexander Cameron Award recipient.
Thank you, Kieran, and our panel members for an excellent discussion. I am delighted to now move on to the presentation of the inaugural Sir Charles Alexander Cameron Award for Population Health, and to introduce to you our first recipient of the award. I am delighted to introduce to you this afternoon the recipient of the inaugural Sir Charles Alexander Cameron Award, Dr. Mike Ryan. Dr. Ryan is Executive Director of the WHO Health Emergencies Programme and currently leads the WHO team responsible for the international response to COVID-19. Dr. Ryan has been at the forefront of managing acute risks to global health for 25 years. He first joined WHO in 1996 with the newly established unit to respond to emerging and epidemic disease threats. He has worked in conflict-affected countries and led many responses to high-impact epidemics. He's a founding member of the Global Outbreak Alert and Response Network, GORN, which has aided the response to hundreds of disease outbreaks around the world. In 2001, he was deployed to Uganda, where he was head of a team of international experts involved in the containment of the Ebola epidemic. He also served as operational coordinator of WHO's response to the SARS outbreak in 2003 and as WHO's Director of Global Alert and Response 2005 to 2011. He was a senior advisor on polio eradication for the Global Polio Eradication Initiatives from 2013 to 2017, deploying to countries in the Middle East and Pakistan. He then returned to Geneva to serve as Assistant Director General for Emergency Preparedness and Response in WHO's Health Emergencies Programme from 2017 to 2019. With this international portfolio, we are very pleased that Dr. Ryan is an Irish physician with degrees in medicine from the National University of Ireland, Galway, in public health from University College Dublin, and then specialist training in communicable diseases control at the Health Protection Agency in London and the European Programme for Intervention Epidemiology Training. The COVID-19 pandemic is one of the greatest challenges that the world has faced in recent times, affecting every aspect of our society. The pandemic has stimulated an extraordinary level of collaboration across the world, and it has also highlighted social inequalities. Like Sir Charles Cameron, Dr. Ryan has been an advocate for a fair and equitable world, a world of global solidarity and cooperation. He talks of finding solutions and sharing equitably, of accurate advice and information, of one global family. To quote him, "Tolerance, kindness, and solidarity is likely our most powerful countermeasure against the coronavirus." Dr. Ryan is also passionate about the effects of climate change, particularly on poor and vulnerable populations who are the least responsible yet bear the major burden of climate change. In this regard, Dr. Ryan was awarded a Lifetime Achievement Award at the Irish Red Cross Humanitarian Awards in December 2020. Speaking in December, Dr. Ryan cautioned that, and I quote, "This pandemic isn't a once-off. We need to learn from our experience of this pandemic to prepare for other major public health crises that may follow. There is an underappreciation of the need to resource serious and ongoing public health infrastructure. It's not a cost, it's an investment, and a way to reduce much greater cost in the future." I am sure, Dr. Ryan, this is a sentiment that Sir Charles Cameron would agree on. Dr. Ryan, we are very proud to see you as an Irish citizen at the heart of the work of WHO. In recognition of your global leadership during the COVID-19 pandemic, I now call upon the President of RCSI, Professor P. Ronan O'Connell, to present you with the RCSI inaugural Cameron Award for Population Health. It gives me great pleasure to invite the President of RCSI, Professor Ronan O'Connell, to present the award and deliver a short address.
During 40 years as what would be nowadays called Chief Medical Officer for Dublin, Charles Alexander Cameron oversaw improvements in public health that resulted in a 7-fold reduction in deaths from infectious diseases in Dublin between 1879 and his retirement in 1919. During his lifetime, his service was recognised by the Crown with the knighthood and by the city by being made a Freeman of the City of Dublin. It is only fitting today, to mark the centenary of his death, that RCSI remembers our past Professor of Hygiene and also our past President for his enormous contribution to public health by inaugurating the Sir Charles Alexander Cameron Award for Population Health. Dr. Ryan, it is right and fitting that the inaugural award is given in recognition of your outstanding contributions through more than 25 years of service in the World Health Organization and for your leadership during a pandemic that has affected every society, every country, every continent. Pandemics change history, end empires, upend societal norms. We can only hope that the recalibration which must follow COVID-19 will recognize the fragile ecosystem in which we live and how easily it can be destroyed. Your advocacy and that of the WHO will be needed then even more than now. Our thanks and congratulations to you and your colleagues in the WHO for your service. Bunsen's Flame by Jason Ellis is a special commission by RCSI to celebrate the centenary of Sir Charles Cameron and the establishment of the RCSI School of Population Health. It is a hand-carved sculpture in alabaster with an engraved plinth of Kilkenny marble. The sculpture takes its inspiration from Cameron's early career as a chemist and is designed in the form of a flame from a Bunsen burner. It is therefore with great pleasure that by virtue of my office of President of the Royal College of Surgeons in Ireland, I present you with the inaugural Sir Charles Alexander Cameron Award for Population Health.
I am delighted to invite Dr. Mike Ryan, our first recipient of the Sir Charles Alexander Cameron Award, to address our virtual guests.
Thank you, Hannah, and thank you to the Royal College of Surgeons in Ireland, and everyone there. It's a huge honour for me, a huge personal honour. I think an honour for those of us who've qualified and done public health training in Ireland, and for all of us Irish who work abroad internationally in the spirit of Cameron in terms of preserving population health around the world, and working as we do very much in his spirit. I know the energy, his work ethic, his desire to be amongst the people he was serving, knowing the ground, translating the science into practical actions, and then providing communities with the means to implement that, supporting communities in being the front line of response and in avoiding stigma and providing communities with the opportunity to benefit without the stigma that goes with that. So much of this polymath's life is something so interesting, and in many ways, many Irish public health and humanitarian workers work around the world in that spirit every single day. So I will accept this reward on behalf of all those who work for population health, especially those Irish who do that at home and abroad. I'm particularly pleased to get such an award from the Royal College Surgeons in Ireland. I know that population health is a major focus going forward for the college. I know that the new Institute of Population Health will help to move community health. In the old days, we had community health and public health, and I think we need to redefine what we mean by population health going forward, and where the investments need to go in preparedness and resilience, in preserving the health of our populations and understanding those determinants of health, and ensuring that the right policies are in place so our populations remain healthy, our planet remains healthy, our animal kingdom remains healthy. We are intertwined, the human population, the animal population, and this planet. And we need institutes and academics to really pursue that knowledge around how intertwined we are and how we can work at every level in society and across all sectors to ensure we preserve that wonderful space that is health, and reflect upon Cameron's vision that health should be more prominent than disease, and that we should continue to push that health pushes disease away from people's lives, and that suffering we've seen in the last 2 years. We can learn, unfortunately. I think you were saying just before that, we were saying before that he had been quoted as saying that pain in itself was a way of taking action. In some senses, it can protect us. Well, may the pain and suffering of this pandemic, and in honouring those who've lost their lives in this pandemic, that we may use that to make sure that we put in place the kinds of protections for our populations so we never have to suffer that again. Again, with thanks to you all, and with great humility, I must say, to receive an award from my peers at a moment like this gives me great energy, and it gives my staff and everyone at the World Health Organization great energy to receive such a prestigious award. Thank you.
I want to thank our chair today, Professor Kieran O'Boyle, and our panellists, Dr. Ida Milne, Professor Donal O'Shea, Professor Emer Shelley, and Dr. Kieran Wallace. In particular, I want to thank Dr. Mike Ryan for taking the time to join us today, and to commend him for the outstanding example of leadership he's giving to future healthcare professionals across the world. His dedication to evidence-based public health and the clarity and honesty he employs when engaging with the public is an example to us all. He is a most deserving recipient of this inaugural Sir Charles A. Cameron Award for Population Health. To those of you who joined us today, thank you and stay well.